I actually am one of the physicians, so what I do is just general OB/GYN. What I enjoy doing, and probably do a little bit more than some of the other physicians, is the surgical aspect of gynecology. So I do a lot of robotic surgeries. I do a lot of the non-invasive surgeries through the laparoscope, which I find enjoyable, and you know, I kind of enjoy kind of doing the cutting edge stuff. I'm also the administrative physician of the group, so I do a lot of the business of the practice. So for a day a week, I pretty much address all the business concerns, which involves, you know, employee issues, employee benefits. I discuss contracts with insurance companies. I look at our malpractice insurance, and then just make sure that the operation is smooth and help coordinate all the managers of the group. The most meaningful part to me is solving difficult problems. So when patients come in with long-standing problems, or they've been to a few other practices or other physicians in the state or around the country that really have not solved their problem, I find those both the most challenging, but ultimately if I'm able to solve those, you know, dilemmas, I think that's really what makes me tick. I really enjoy, you know, the more complicated things, and finding solutions after, you know, others have failed. Yeah, in general, I think people that come in for the first time to any medical practice, I think, are a little bit intimidated. So I would suggest that when people come for the first time, they try and write down those questions that they would either be too embarrassed to ask the first time, or that simply would slip their mind. So in general, I think patients should write down you know, kind of their key questions, and even some of the odd questions that they think are stupid, because I think they're the ones that people leave without answers to. So if anything, kind of rehearse a little bit what, you know, a patient would intend to get out of that visit.